We are from Group 9.
And our members are Elfaya Zafanabilah,
Farauletul Faizah,
Ramadan Wimangkit Mahendra,
Salsabila Buraida Rahman.
In this video, we would like to invite you learn together about asking reporting health problems and diagnosing.
Before going to the main segment, let's go to the mini quiz first.
So we have prepared 3 questions related to the topic. Check this out. We'll give you 50 seconds for you to answer those questions. Ready? Go!
Great! Congratulations for you who can answer it well.
Does anyone here feel confused? Don't worry, in the next segment you will find the clue of the answer.
This is the 9.2A show. Have a good time watching.
Thank you everyone. Welcome to the 9-to-8 show. I'm Salsabila and I'll be your host for now. So, in this episode, we're going to talk about some different things than usually we have before. The topic of today is coming from inspiring people around health issue. It is fight against coronavirus disease. Please welcome Dr. Ramadan Dwi, Nurse Farah, and Mrs. Elfaya.
Good morning, Miss.
Good morning. Good morning. Please have your seat.
Okay, thank you.
Okay, thanks for coming and give your time for 9-to-8 show. Well, it's my pleasure to meet your Dr. Ramadan, Nurse Farah, and Mrs. Elfaya. Well, how are you doing?
Of course, I'm great.
Me too. I'm doing fine. Very nice to hear that. So, ladies and gentlemen, for information, Dr. Ramadan and Nurse Farah are medical personnel in Wisma Atlet Jakarta, which as we know, that is place of isolation or treatment for COVID-19 sufferers. And Mrs. Elfaya is the one of patient who have been treated here. Am I correct? Yes, you're right. Now, can you introduce yourself for me and for the viewers at home? Maybe first, doctor, please.
Me? Okay, thank you, Miss Salsa.
Yes.
My name is Ramadan Wimangkit Mahendra, usually called by Ramadan. And I'm a general practitioner and I've been worked as a doctor for 3 years. Now I am work at Wisma Atlet for help people who suffer from COVID-19.
Okay, Nurse Farah, next.
Okay, it's my turn. Thank you. My name is Farauletul Faizah. You can call me Farah. Last year, actually in August 2020, I just graduated from my campus and I got this nursing diploma title. And then after that, not long after that, I applied to the medical team volunteer of Wisma Atlet, and then Alhamdulillah, fortunately I got this great opportunity until now. Thank you.
The last, Mrs. Elfaya.
Okay. Hello, my name is Elfaya Zafanabilah. I am 20 years old and just an ordinary engineering student at University of Indonesia. I am one of the people who succeeded to recover from COVID-19.
Thank you so much for introducing. So now, the viewers at home and I know about you more. I think I want to ask first to Mrs. Elfaya.
Yes.
Did you ever think that you will be one of the people that infected by COVID-19?
Oh sure, I really don't think it can happen to me. I always do the health protocol as much as possible. I wear masks, I wash my hands, I keep the distance from others, and then I stay away from the crowd, and also I reduce mobility by stay at home until one day I became the COVID-19 patient in those mountains.
Can you tell me how the chronology is until got you infected?
Yeah, actually I get infected from the people without symptoms. One day my best friend came to visit me. Coincidentally, she visited me when I was not fit. She came to give me some souvenirs and also told her story while visiting Australia 2 days before. I didn't think that she was actually sick because she looked very healthy at the time. But unexpectedly, few days later, she informed me that she was hospitalized by COVID-19. You know, my health condition was getting worse at the time, so that I immediately went to the hospital to do a COVID-19 swab test, and the result was positive. Since then, I've been taken care of in Wisma Atlet.
What symptoms did you feel at the time after you know that your condition was getting worse because COVID-19?
I got fever at the first day until 38 degrees Celsius, and then in the third day it became worse until 40 degrees Celsius. Furthermore, I experienced cough and shortness of breath.
Oh my god, I can imagine if I were in your position, Mrs. Alfaya. You are great girl.
I can go through all those phases because I always praise the Almighty, and I was also able to get through it all because of the doctors and the nurses who have helped treat me during my time in hospital.
Now, I want to ask you, doctor, what are the symptoms that actually occur in a COVID-19 patient from the medical side?
COVID-19 affects different people in different ways. Most common symptoms are fever, dry cough, and tiredness. And also there are serious symptoms like a difficult breathing or shortness of breath, a chest pain or pressure, and loss of speech or movement.
What methods are usually the doctor used to cure patients from COVID-19?
There are so many methods usually we use. And also it must suit by the needs of patient, such as give a COVID test that involves putting a 6-inch cotton swab up both sides of nose for about 19 seconds. Listen to patient lungs, give a chest X-ray or CT scan. Some patients even need a ventilator to help them breathe. Well, the patient also get fluid through a tube or IV in their arms to keep them from getting dehydrated. We also closely monitor their breathing every time, and we will do all methods that possible for recovering the patient from COVID-19.
How do you inform patients about their health development?
Even the health development of the patient, whether good or bad, we still need to inform the concern to them. We must convey both to the patient, also their family. But one of important thing that we should do when we inform is give the support as much as possible we can, because indirectly it will make the patient eager to recover.
Yeah, I agree with you, doctor. I'm sure all the patients really need support system for help them recovery. And one of the support system, one of the person that always beside the patient every time when try treat on the hospital in a nurse. Am I right, Nurse Farah?
Yeah, maybe you could say like that.
What are the obstacles that you feel treating the patient of COVID-19, Nurse Farah?
In our profession, obstacles and challenges are definitely there, including for nurses. But keep in mind that as nurses, we have been sworn to always help people in mind. We definitely feel tired, but after seeing the patient smile and then listening to the patient say thanks for us and seeing the patient condition is getting better day by day are enough to make us happy. We are happy to be beneficial for others.
How amazing you are! I also heard as a nurse had to collaborate with other health personnel. How is the coordination of the work done, Nurse Farah?
First, we have to visit the patient, ask them if there are any complaints. We usually ask like, how are you feeling today? Do you have any problems? And the patient also often calls the nurse through the button next to their bed. Usually, the patient will call if they need help or feel a complaint. Shortly after the patient presses the button, we will go straight to them. Like what the problem, what's make you call me, and then what's troubling you, and then or what's the matter with you, and The patient will tell anything what they want to tell. After we got the information from the patient, we recorded it in the patient data book and reported it to the doctor. As Dr. Ramadan said, most patients complain about their shortness of breathing. Some of them also has chest pain and many more. After reported to the doctor, then we will discuss together about what intervention are appropriate for the patient. It's very possible that the prescribed intervention will also involve other medical personnel such as nutritionists and pharmacists.
I'm really impressed with you with all medical team in Indonesia. You are really great. You are really working hard. Let's give them applause. We're almost at the end of the segment. For Dr. Ramadan, Mrs. Farah, and Mrs. Alfaya, could you give some tips for me and also for all viewers at home how to be protect ourselves from this extraordinary disease?
Thank you, Miss Hansa. For you, all Indonesian people, whatever you are, whenever you are, and wherever you are, please protect yourself and others with wearing masks. Keep your distance and stay away from crowds. And don't forget to always wash your hand with water and soap. And when water and soap is not available at you, please use hand sanitizer to keep your hand always clean. And don't forget, stay tuned to get vaccinated when the vaccine is available to you.
Okay, basically, the human body has an immune system to fight disease-causing virus and bacteria. However, there are things that weaken a person's immune system. And then, therefore, you should always improve your immune system by consuming nutritious food, getting enough rest, and managing stress well, doing regular sport exercise, and taking supporting supplement if necessary.
Maybe the tips from me are same as what doctor and nurse say. I hope this pandemic will end soon and also doesn't increase the number of the cases that exist. And for all of you who are struggling with COVID-19 now, I hope you will recover soon. I know you guys can pass it. Please follow what the doctors and the nurses have suggested. Let's definitely fight this disease together.
I hope so. Thank you for your all suggestion. Of course, if we do all suggestion well, it will help reduce the level of the pandemic in this country. Once more, please give a hand to the Dr. Ramadan, Miss Farah, and Mrs. Alfaya. So it's the end of the show. Thank you for watching 9 to 8 show from the start to the finish. Ultimately, the greatest lesson that COVID-19 can teach humanity is that we are all in this together. I'm Salsabila Buraida. See you tomorrow. Bye.
How about the talk show, guys? Is it interesting?
And having fun too? Let's match your answer with the right answer below.
Once more, congratulations for all of you, you can spell it well. You are so great.
So guys, this is the end for our video.
Thank you for enjoying our present.
And also thank you for studying with us.
See you next time.